Good morning. Firstly, I'd like to forward my greetings to the leadership of the church, in particular, Muruti Pila, Muruti Makhoto, and Nebayena Kaufela. I greet you all in the wonderful name of our Lord Jesus Christ. Amen. I would like to thank also the leadership for adding me this opportunity to come and share my testimony with you, Bazalwani. My name is Dr. Dieketseng Moloi. I'm the CEO of Leratong Hospital. I joined Leratong Hospital on the 3rd of May as the CEO. And we all remember that was under level 5 lockdown. Bazalwani, it was like being appointed a general in the middle of the war, a war that you did not plan, a war that you find in full steam. Leratong is a huge regional hospital. It is about 855 beds. It's serving the entire West Rand and the Soweto regions. When I was offered the post, I was in doubt. I didn't know what to do. I relied on the word of the Lord. And when I looked at Jeremiah, when it says, before I formed you, I knew you and I had approved you as my chosen instrument. And God, but I don't think I'm ready. And the Lord said, don't say you are young and you shall go wherever I send you, because I will be with you. If I have to also rely, this Bazalwani is a testimony from my side. And I'm glad also Sister has also gone through the background, because mine is truly a testimony. Our hospital was not initially identified as a hospital that would manage COVID-19. But somehow, as the cases started rising, we moved from being a non-COVID hospital to 100% COVID-19 hospital. The initial plan was that some patients that are asymptomatic or that are mild symptomatic will go to the identified structures that have been built. The patients that were very, very acute had to be taken to Charlotte Maxeke Academic Hospital. But I am telling you, Bazalwani, plans didn't go that way. We suddenly found ourselves overwhelmed with all the wards having either suspects of COVID-19 or positive or confirmed cases of COVID-19. I remember, seeing another granny on admission, and I was wondering, where are we going to take? Because all the wards were threatening, because some had suspects, some had confirmed COVID-19 patients. So we were overwhelmed at that time, Bazalwan. In the light of speed, we had to ensure that there is compliance. We had to ensure that we put all systems to ensure compliance to screening, to social distancing and all. And we also had to ensure that our staff members have access to personal protective equipment. And we did the on-the-job training for COVID-19. It was very tough. It was very tough. And then that's when I comforted myself with Psalm 46 that said, be still and know that I'm the Lord. I said, Lord, I don't have I don't have strength. I don't have the know-how how to manage this. Please take over. And Basalan, that's exactly what God did. The sad part of COVID-19 daily was that it was threatening both staff as we're also receiving those patients. As a general, you join this war in the middle and you try to understand what is this enemy that we are dealing with. And you also understand that this is the enemy that is highly understood, but also as a hospital, we are highly under-resourced at that time because in the provincial plan, the Ratong Hospital was not meant to manage COVID-19. At the same time, is organized labor saying, but CEO, we were told that the plan of the province is that the patients of COVID-19 are not going to be treated in this hospital. And I then said, no, a patient is a patient. Unfortunately, we have to adjust ourselves. Barcelona, I had to be a beacon of hope where there was no hope. And when you just say, God, take over, you realize that even the systems that we are trying to put in place are blessed because we also received donations from different areas. And I was fortunate, Bazalani, also to have a team of men and women who were hard at work. What is also, as I said earlier on, is that when you are trying to manage your patients, we had staff issues to deal with. There was fear, there was anxiety, there was uncertainty. In my language, but we had to give each other hope. We had to rely on the Lord. At Leratong, we had about 591 admissions. Unfortunately, we lost 124 patients, but we managed to discharge 467 home. And that's when I said the power of the Lord was evident at that time because we could see people being discharged from our wards with the little resources that we had. But Alani, why I'm saying what I'm saying is a testimony is that Leratong has a staffing complement of almost 1,800 staff members, from cleaners, porters, allies, support staff, the back office, as well as the clinical staff. Out of those 1.8, 241 tested positive for COVID-19. The wards were piling up, but the staff had to go home and be on self-isolation. It was a scary point. But God, Bazalwani, I'm here to tell you that we serve a faithful God. Out of the 241 that tested positive for COVID-19, we did not have a single fatality. I cannot explain it. All I know is that God was in control. We're still under COVID-19. Things are a little bit better now since the levels have been relaxed. At least we are now trying to reorganize ourselves, and I hope we'll be better prepared for the resurgence that all of us are expecting. And finally, I would like to say, in my experience of leading under turbulent times, I had to learn that as a leader, you need to learn to navigate through those massive storms. OHS issues, patient care issues, organized labor issues. It becomes a huge amount of stress on yourself as well as a human being. But then you need to try and ensure that you rely on a source that will give you strength. And for me, that source was the word of God. For leaders like me, I'd just like to leave with a few verses, because that's what has helped me and my team in managing this institution under these times. Matthew 6:33, but it says, but first seek the kingdom of the Lord and his righteousness, and all things will be added unto you. When you are a leader, Bazalwane, you need to be a God-fearing leader. You need to have your source of strength in the Lord. And I think even myself, I've been fortunate that my bishop and Pastor Ray, they've been giving us daily morning inspirations. At my church, there's a 5 a.m. prayer every day. By the time you go, I would go to work, at least I would have had an intercession. And then before I even do anything, I would start with the word of God. And also trust in the Lord. Do not lean in your own understanding. COVID-19 has really taught us that there will be diseases, there will be pandemics that would not understand fully. And as doctors, I'm a doctor myself, I can just imagine what was happening to the doctors on the floor, because we usually have protocols, and you know, we know how to manage many conditions. However, with COVID-19, Bazalwane, it was a different story. It was a different ball game. Deuteronomy 31 verse 3 says also, be strong, be courageous, do not be afraid. Our God will be with you, will never leave you. I remember going to Pastor Mahazo's office, you know, I'm too overwhelmed. This is the word that we shared, to say, even if you are not strong yourself, somehow people would like to see a strong individual when you are dealing with such situations. And with this is the word, this is the verse, Bazalwane, that carried me through. And lastly, let's have faith. It's the only thing that will sustain you in difficult times, because often you don't know how things will turn out. You plan, but it might not turn out the way you have planned. But faith is the only thing that will sustain us. With these few words, Basics, I would like to say thank you.